two facilities I found are the Convenient Care Skilled Nursing Facility and the Beechwood Skilled Nursing Facility. Both facilities focus on safety, fire safety, and hurricane prevention, preparation, HIPAA policies, and promoting health and wellness. The Convenient Care Skilled Nursing Facility promotes safety within the facility by providing each resident with an emergency call light in their bedside, bathroom, and shower room. This is actually specified in their handbook. The facility has a program for fall prevention. They encourage patients to ask for assistance and using call lights. They educate their staff in leaving call lights handy so patients are able to access for help. The facility promotes good body mechanics for helping patients move or transfer. Good body mechanics are implemented within the staff and training to patients and caregivers for safely getting patients up, but also to ask for assistance as needed. In difference, the Beechwood Home promotes safety within the facility by asking patients and family members to report any minor or major injuries that occur inside the facility or outside the facility to the charge nurse. They also monitor environment modification and recommend reduction of clutter in the rooms and in the hallways. I found very important that the Convenient Skilled Care Nursing Facility has in their policies a program for fall prevention. They're training to their staff about proper body mechanics, and also to family members in how to safely get patients up from bed. This will help patients with fall reduction and the facility as well. Both facilities have a fire safety prevention and hurricane preparation protocols. The Convenient Care Skilled Nursing Facility follow emergency protocols required by law, including emergency food and water supplies and the use of emergency generators. And the Beechwood facility also includes emergency food and water supplies and an emergency generator. All resident staff and visitors must follow the protocols and follow rules about evacuation processes. Both facilities also are big in following HIPAA policies by helping patients to keep their medical information private and disclose only to those approved by residents. Both facilities also have infection control policies. They train patients, staff members, and families about hand washing and safety measurements to prevent risk infection. They ask family members to limit their visits whenever they're feeling ill to promote health and to ensure wellness in all patients. Also, the Beechwood Skilled Nursing Facility, as upon admission, have occupational therapists assessing wheelchairs for positioning and to help with fall preventions. The occupational therapy role will be to maintain safety procedures on these facilities and to educate clients about fall risk prevention, such as use of call lights, buttons, if they need to get up from bed, such as using the bathroom or getting dressed. Provide environmental modifications, such as placing a visual sign for a client with cognitive decline and adding extra padding to a call light for individuals with visual limitations to compensate with tactile input. Our role as occupational therapists is to provide training to the staff to enable patients' independence and social participation. Education to patients, staff, and family members in proper body mechanics to reduce the risk of injury. Instruction to staff in safety transfer techniques, communication, and behavior strategies for patients with cognitive and sensory issues. As a notice, we can train and educate residents about fire drills, nearby exits, following evacuation plans, and recommendations by the staff. We can promote and integrate strengthening and balance programs as needed for clients to be able to participate despite their disability. We also can educate our patients about HIPAA policies, about signing consents, who they want to disclose the information, the medical and personal information in regards of family and visitors. We also educate residents and family members about infection control, promote health and wellness necessary to reduce the risk to get sick. As of this, we can also help patients with positioning and minimizing fall risk by assessing sitting and positioning on wheelchairs, assessing wheelchair for optimal postural alignment, even distribution of pressure, optimal upper extremity mobility, which is required for wheelchair propulsion, check that their feet touch the floor to make sure like if they're only rely on their lower extremities to be able to propel the wheelchairs. Assess if the client benefits from a jetty chair or standard wheelchair and essential functions of occupational therapies to prevent fall risk and ensure safety on any skill or long-term facilities.